My name is Michelle Hamilton, and I'm here with my colleague and good friend, Mara Pinot. We are two oncology dietitians here at the UT Southwestern Harold C. Simmons Comprehensive Cancer Center. This video was created to discuss some ways to manage treatment-related symptoms. These shorter videos, like this one here, will cover each individual symptom. For a full overview, please click on the longer video for staying nourished during treatment. First off, it's important to define what diarrhea truly is. So diarrhea includes both loose and watery stools and bowel movements more than 3 times a day. Acute diarrhea lasts only 1 to 2 days, all the way up to chronic diarrhea more than 4 weeks. Similar to some of the other symptoms, diarrhea can be caused by a variety of reasons. This includes the cancer itself, unfortunately. It could also be caused by the treatment, medication, or an infection, even brought on by the stress of your diagnosis or upcoming treatment. Diarrhea can lead to several complications, including dehydration, difficulty absorbing all of our nutrients, or loss of nutrients such as potassium or magnesium. It can lead to weakness or weight loss due to the loss of fluids, which can affect your appetite. We often hear the statement, "Why should I eat if it is just going to go right through me?" And that is completely understandable and why we need to address the diarrhea to get you feeling better. So what are some tips for diarrhea? Make sure to take the antidiarrheal medication as prescribed. Although dietitians are all about food first, this is a situation where a medication is needed to stop or slow things down. Try to stay hydrated by drinking plenty of fluids, but avoid the sugary drinks. Concentrated sweets can cause an osmotic reaction in your intestines and make the diarrhea worse. So select lower sugar products such as the Pedialyte that Mara mentioned. Consume foods that are high in those electrolytes, such as sodium and potassium, and foods that contain a specific type of fiber called pectin can help absorb fluid in the bowels and slow down the diarrhea. Soluble fiber like pectin mentioned in the previous slide can create a gel and absorb some excess fluid. This can help to slow things down, but speak with your provider or dietitian to see if this is an appropriate option for you. Banatrol, or dried banana flakes, works in a similar fashion. We have a lot of success with this product and recommend it on a fairly frequent basis. Banatrol is mixed with drinks or soft foods and consumed 2 to 3 times daily. Some cancers may need additional enzymes to promote digestion and absorption. Make sure to call your provider if the diarrhea continues, if the stools are an unusual color or odor, or if you are having additional symptoms, or if you are receiving immunotherapy. This slide shows some additional foods to be cautious of while you're experiencing diarrhea. Once the diarrhea resolves, you can slowly resume to your typical diet. Lactose in standard dairy products can sometimes be hard to digest and can contribute to diarrhea. Temporarily transition to lactose-free options or plant-based products for the time being. Limit high fiber foods, especially foods higher in insoluble fiber, which includes things like vegetables and certain nuts. Limit sugar-free products that contain sugar alcohols because these molecules can often cause GI upset and contribute to diarrhea. Moving on to things that should be avoided, really want to watch out for those gas-producing foods such as broccoli, cabbage, or beans, and limit alcohol and caffeinated beverages when possible, as both of these can cause diarrhea and dehydration.
Here's some additional resources. These are resources that us dietitians use on an almost daily basis. At the bottom is the UT Southwestern Oncology Nutrition website. That's a great one to go to. A lot of information just based on what we provide and recommend within our patient populations. American Cancer Institute for Research is another great one. So reach out to either your dietitians on your team or to these resources for more research-based information. And thank you everyone for listening into this presentation. If you have any questions whatsoever, please reach out to your medical team. And if you don't know your dietitian, they can let you know who that dietitian is. And if you do know your dietitian, please reach out if you have additional questions. Thank you so much and have a great day.
Thank you.